Hello, all, and welcome back to The You in Youth by Sohail Daulat. The You in Youth is a new podcast funded by the National Reach Coalition in hope to raise awareness of the stories of the youth between the ages of 18 to 25. The National Reach Coalition aims to help underserved racial and ethnic communities achieve health equity, and we hope to use this podcast as a way to build resiliency through unity among the youth by sharing the impact COVID 19 has on us. If you're interested in being interviewed on this podcast, please reach out to me at sdaulat@email.arizona.edu. That's spelled SDAULAT@email.arizona.edu. Welcome all to the second episode of The You in Youth. Today, I have Karen Morgan, who is a student at the University of Arizona and a member of the Navajo Nation. Today, she will be sharing her experience with COVID 19 and how it has impacted her and her community. Welcome, Karen. So, do you mind introducing yourself? Tell me a little bit about who you are, your major, and just a little bit more about your background.
Hello, Sohail. So my name is Karen Morgan. I'm part of the Navajo Nation. I'm from Tuba City, Arizona. I'm majoring right now in applied humanities public health emphasis with Chinese language emphasis and a minor in animal science. So, and right now I'm also part of the Step Up program, which is part of the Cancer Research Center with the University of Arizona.
Oh, awesome, awesome. No, that's great to hear. So, the first question I kind of want to ask you is that the Navajo Nation does face many health inequities already before COVID 19. Do you mind talking about some of the health inequities you've seen that they have faced and how COVID 19 has worsened it?
Sure. So most of what I experience or know from certain individuals is that in the Navajo Nation, we live in a rural community where everything is spread out. The closest hospitals we have are about 75 to 100 miles away from us. So we have a lack of healthcare needs as well as we are limited if we are going to get cancer screening. It's only limited to like bigger states or bigger hospitals, which is located in Flagstaff, Arizona, or we have to go to Phoenix. Another place would be we would have to go to Albuquerque, New Mexico, which is another 3 hour drive away from any of us. I know because I live in Sanders as of right now, and the closest hospital to me would be Ganado, Arizona. It's called Sage Memorial Hospital, and that is about an hour and a half drive away, as well as we lack knowledge about certain cancer screenings, as well as the vaccinations that we have to get. Some of us don't even have insurance to get health checkups outside of the IHS hospital. And most of us are just, we have obesity problems with diabetes mostly because the closest grocery store we have is actually a gas station where most everybody knows is a gas station just has soda, a lot of chips, just like already pre-made processed food. So that very takes a toll on us. I know in high school, some students used to get taken to school. They will always stop at the gas station to buy sugar, which is like a lot of soda, a lot of candy, like hot Cheetos as well, and just eat it throughout the whole day of school. So that mostly contribute to the youth getting diabetes as well as having obesity later on in life.
Oh, wow. I was unaware of how scarce the food is. So, do you feel that food scarcity is a huge issue that aggravates the health inequities? Can you talk a little bit more about the food scarcity aspect of it? And do you feel it's food scarcity of just healthier food options, or just tell me what your thoughts are on that?
So mainly it's more of the knowledge of the lack of knowledge that we have on certain foods. Then from what I know, the Navajo Nation people, we were raised off of the land, so we're constantly having consumption of red meat, which is very bad for us because it can increase our chance of having cancer later on to like 23%, as well as we're constantly we're eating a lot of fatty food with a lot of carbs, which is like bread, butter, etc. So most of the food that we consume and the lack of knowledge about having healthier choices, what's making us having more problems with obesity.
Yeah, no, that makes sense. And do you feel that with COVID-19, it made things worse? Oh, did you see any difference with how COVID-19 impacted that?
So when COVID-19 first started out, and the closest grocery store that any of the Native Americans would go to is a place called Gallup, New Mexico, where it is one of the second largest, busiest Walmarts in the world. And from what I know, once COVID-19 happened, the number of cases in Gallup increased by a lot because it was mostly Native Americans constantly going over to Gallup just to buy groceries. And because of that, we don't have that knowledge of maintaining that distance of 6 feet apart. So when I'm passing by through Gallup, I can see from along I-40 is that the line stretches all the way for about a mile with people just packing in, trying to get their food and trying to go out. Most people bought foods in bulks, mainly from what I saw, mostly everybody got chips as it can last for about 2 to 3 days, depending on the individual. A lot of people bought canned sodas like Coke, Dr. Pepper, and like all those high maintenance sugars, as well as people just bought like canned foods and mostly, and none of them probably purchased any of the vegetables because it was just mainly junk food that we know how to eat. So COVID-19 really impacted us a lot because we also had a set curfew from 5 all the way till 5 p.m. from Monday to Friday.
Wow.
Yeah, and the only way we would able to go to work is if you had a federal working pass. Navajo Nation government, they closed down all their buildings except for the hospital. And the only time you could go to the hospital if it was an emergency. So there was, because the hospitals just had a bunch of COVID-19 patients, people getting diagnosed, a lot of deaths, but I would say COVID-19 impacted more towards the Navajo Nation Police Department.
Okay, okay. And so then that does make things a lot harder. And then also when you were talking about everyone just going to the store, do you feel like that also increased exposure because there's only limited amount of stores to go to? That increased exposure to COVID-19 and increased amount of spreading of COVID-19?
Yeah, I would say since the lack of knowledge that we have of trying to maintain that 6 feet apart, that increased our risk of getting COVID-19. The only two stores within that everybody would go to is Walmart or Safeway, which were
Okay.
the two main busiest grocery stores that we had, besides like Lowell's or Bash's. But either with those ones, there would still be a long line of people trying to purchase their food before curfew started.
Oh wow, that's good to know. So going back, you were also talking about how the health screening, the access to healthcare and hospitals and clinics is very limited as well. So, can you talk a little bit more about what you would need to do to go get a simple checkup or screening, especially with COVID? And also, is there access to a mobile clinic, or is that something that you think would have been a lot more helpful if there was some mobility in the clinics?
So right now we have we have the main hospital, which is located in Fort Defiance. And from there it branches out to multiple different hospitals that we consider as clinics. So the closest clinic I live to is 30 minutes away from me. It's called Nadazil Clinic, which is in Sanders, Arizona. And um, they limited the access of how many people could go within the building. You constantly have to wear your face mask, as well as once you enter, you have to get checked first with temperature, as well as ask multiple questions. From there, you're allowed to go in, but you can only go in if it unless it's an emergency. Right now, it right as of right now, you can go in to get dental care as well as an eye exam, but that is as long as you keep your face mask on, as long as you already have the two vaccinations of Moderna or Pfizer, as well as if you have never traveled out of the country within a year, from 6 to a year month span.
Do you feel that a mobile clinic would be a lot more helpful to allow for more people to gain access, or what are your thoughts on that?
So we used to have a mobile clinic, but that was only for like dental, little health checkups, and as well as just an eye exam. Those used to be our mobile clinics, but nowadays we don't have any mobile clinics from what I know. So I would think that having a mobile clinic that travels around the whole Navajo Nation and more towards the areas that are that are outside of like the main busiest areas would be very beneficial for a lot of individuals because we tend to live very apart from each other. As I said, Napa Nation is very rural. So if you ever visited, you would understand that everybody's located at different places. So I would say that a mobile clinic would be very beneficial to us to give us constant knowledge about vaccinations, health insurance, as well as, oh, this is the reason why you need to get a vaccine, as well as have somebody have that cultural competence to understand one another would be very helpful. Even if it is a white individual, they should be able to learn the history as well as the cultural and traditions that the Navajo Nation people hold in order to help an individual. Because of nowadays, there is the mistrust between a doctor and a patient, which is um, very hard on the Navajo Nation people because we lack the trust from a doctor as very we only have a limited of education. Well, as a doctor has that status of being a doctor, having that medical degree. So it'd be nice to have somebody to understand that cultural competence between two different individuals. So yes, a mobile clinic would be very beneficial for us.
Yeah, no, that you bring a really good point about cultural competence and how doctors gain that cultural competence and increase the trust. That could really have a stronger bridge between a doctor and a patient, which could lead to more knowledge, access to knowledge regarding COVID-19, which, it makes me wonder. So, can you talk a little bit more about the cultural competence you're talking about, but also like, so do you see that across the Navajo Nation there is that big mistrust in the healthcare system, and what are your thoughts on that, as well as how you think things could change to make it better?
So 2 weeks ago, my sister took my grandfather to the hospital located in Tuba City for a daily checkup. And he only got a checkup so he could get his bandages replaced with new ones. But the doctor he was seeing, which was a white lady, told him, I can't do it because this is not within my field. And then my sister told her, you're still a doctor. You learn every single process that another individual that's a doctor within another side learns. So it should be a lot easier for her, but she didn't want to do it. So a nurse, which is a African American lady, came up, cleaned his whole feet, bandaged everything without asking questions. From For a white person to deny helping a Native American, I would kind of see that as discrimination or segregation, because she's also a doctor. You don't always need a nurse to do what a doctor doesn't want to do. A doctor is has all these experience, as well as they had to go through medical school, do rotations, so they should also know how to clean a person's foot, wrap bandages, etc. So I think that that also brings a lack of trust, as well as when a doctor is talking with a patient, a doctor uses have a higher has a higher education, or they use so high medical terms that a patient doesn't know. So breaking it down and speaking to a level that the patient will understand is very helpful, and it can slowly build that trust up. Because I know I have a sister that's a medical doctor. When she talks to my father or another individual, she likes to challenge a person. Her voice is more like she's talking professionally to that individual. And this individual, they lack the knowledge of what she's saying. So there's miscommunication that happens, and etc. So I think with like using intercultural competence, which is more towards having a person have values, principle, as well as demonstrate behavior that is acceptable to the individual, as well as bringing themselves down to that individual's level, as well as learning about the culture, traditions, etc., could help a patient have a better understanding, knowing that, oh, this is the help that I need. Maybe they are right. Maybe I should get checkups, etc. So I think building communication, having that built communication would increase the trust, as well as increase a Native American's need of going to the hospital to get health checkups would be very good. It would have been a lot better during COVID-19 to have us gain knowledge about what COVID-19 is, symptoms, how we're supposed to cooperate with it, as well as um, exercising and maintaining that distance from the person would be very helpful during that time.
Okay. Wow, very interesting. And yeah, no, that's very scary to hear, especially during a time of COVID and a pandemic that has affected not just our nation but the entire world. And that the access to healthcare is the most important thing. And the fact that even when even though the access to not only is the access to healthcare somewhat limited, or even when someone may approach, they are sometimes denied, and that miscommunication there is just very concerning. And for sure, that is something that, especially during a pandemic, should not be there. And that's just very scary to hear. So my next question, kind of want to talk about is, I did a little reading and I saw that Native American reservations get a lot of money from the casinos that they run, but because of COVID, the income was declined. Like the income, there was less income, which led to defunding of a lot of projects, including healthcare access and stuff like that.
The casinos that we have, we're the only Native American tribe that owns our casinos. If you ever go out to like Montana, they don't own any casinos. They don't have the funding to do it. but most of our funding comes from the government itself. I know one time Navajo Nation asked President Donald Trump to give them $60 million. Donald Trump goes, sure, I'll give you $60 million. He gave it to us. But out of that $60 million, we only used 1 million. And because of that, we had to send the rest of the 59 million back to the federal government because the Navajo Nation government as well as the council, they it's very hard to agree on helping their people, as well as we don't have that knowledge of how to get away from the IHS and use our own healthcare system. Because right now we're like very slowly having to use our own healthcare system besides the IHS. So I would say that even though the amount of money we got, our council delegates as well as the Navajo Nation president doesn't know how to use that money to help their people.
Oh, wow, that's really interesting. So, can you tell me a little bit more about the Navajo Nation's government and the interaction that the government has with their people?
So right now with the Navajo Nation new so-called new president, Jonathan is, I think the only health outcome he ever did was more towards the youth, was just having an annual Just Move It event, which is just you either run 5K or you can walk it. Another one was walking a 10K or running the 10K, but that was the only event he ever accomplished throughout his term as president. So I would say, even with COVID-19 happened, from what I heard from stories, COVID-19 first started from a church revival. Individuals from Texas came to the Navajo Nation having a church revival. And from there, the priest was the one that was sick, and he got everybody within that whole tent sick. And from there it spread. What happened was that the Navajo Nation didn't have a policy about quarantining an individual as well as a community that got infected with an infectious disease. And because of that, it spread a lot more. So the people that were diagnosed with COVID-19 got transferred to a place called Kayenta, Arizona. From there, the hospital didn't follow protocols that CDC gives to every hospital about if an infection happens, quarantine everybody within the hospital. That includes like EMTs, etc., anybody that came in contact with the individual that got sick. But they didn't follow such protocols. And the people that got sick were transferred from Kayenta to Chinle. From Chinle, some individuals stayed, and from there they moved over to Fort Defiance Hospital. And because of that, the virus spread out more. And because of the lack of knowledge that the Navajo Nation's epidemiologists, as well as Navajo Nation president, because of their lack of knowledge of such virus, as well as not setting up a pandemic or epidemic protocol, really, that because of that, it really hurt the Navajo Nation people. And because of that, the new Navajo Nation government, it's not as stable. There's miscommunication between the Navajo Nation president and the vice president party. There's always interconflicts between us Navajos, as we're like very superstitious of one another. We don't really trust one another. So there's that mistrust within our own tribe. And because of that mistrust and miscommunication, it hurts all of us.
Okay. And so, can you talk a little bit more about how that mistrust and miscommunication during a time of a pandemic and COVID-19 affected the youth? Do you have any thoughts on that?
So because of like mistrust, miscommunications, all the Navajo Nation schools were shut down. All students had to resort to learning from their homes. And because they're learning from their homes, their parents had to buy Wi-Fi, like internet data connections. And some parents, they live such inside the rural community where there's no signal, nothing. And some parents, they don't have money to purchase Wi-Fi, and that hurted them financially. And it also, most students, they don't like learning online because they were distracted with playing on their phones. They're always video gaming, as well as they're doing something else. They're like walking around outside while class is in session.
Okay.
Us they know how long a class session is, which is an hour. So some of them just go outside to play and they come back within before the hour is up.
Yeah.
So yeah, our education for the youth that studied online was very hard. So I don't think most of us retain knowledge from an online.
And so, do you feel that the government could have played a bigger role in not only making sure that there was greater access to Wi-Fi and technology, but also in just the educational system?
Yeah, yeah, I think they could have played a bigger role. So we have funding set aside for us for Navajo Nation ourselves. We have a trust, a lump sum of money, which they could have used it towards helping the youth, as well as giving money to the police department, as well as using it for healthcare needs. But with the money that would be put to the youth, they could have been purchasing their students like computers, like give money out to um, each school district and say, here's the money, have your students buy computers for your students so they could use it for better online, as well as make sure you're constantly monitoring it, and have your teachers recommend that each student keep their cameras on, as well as give them reimbursements to use for better internet connection. I think one school, for example, did that very well, which is Chinle. They have a Chinle High School was that told all the parents, if your child wants a computer, tell them to come to the school, give us $25 down as like a little down payment, just in case anything gets broken on the computer, just like a safety deposit
Yeah.
um, money. So they did that, exchanged that money with a computer. So each student was able to get a computer themselves. And I think now, when school starts back up in August, those computers that were given to the families will be brought back, and that $25 will be given back to the family if there is no damage on the computers.
Okay, wow. That is really amazing. That was an amazing initiative, and I'm glad that something was trying to be done to overcome that barrier, and that's exciting. And I wish that was done at a much larger scale. Okay, so thank you so much. As we are coming towards an end, I do have one last question, and I kind of want to hear your thoughts on the COVID-19 vaccine and what concerns the youth may have from the Navajo Nation regarding just COVID-19 and the vaccines in general.
So I got my vaccine back in December, but I got my vaccine outside of the reservation. So I was able to get Moderna in December as well as get the second dose in January of this year
Okay.
because of my education as well as having a sister that was a medical doctor. She was constantly providing us with like information. And because of that, my dad owns a catering business. And we were trying to tell everybody, get your shot, your the Moderna or Pfizer. They're it's like getting a regular flu shot. It's very important, very beneficial for your health, even if you're a person that has diabetes or having obesity problems, etc. It's very important for individuals that are sick to get vaccinated. And because us Navajos were like very gullible, most of them have like TVs and they believe anything that is said only once. So some people on TV were saying that, oh, the COVID-19 vaccine shots mutates you as well as it gets you very sick, etc. Because of that, it created a vaccine hesitancy for a lot of Native Americans because they were iffy about getting said vaccines. But other ones that were more like traditional, they didn't get it because it didn't follow along towards their religion, towards their traditional ideals or their cultural ideals. So that was, I think that also played about 20% of people not getting vaccinated. The other ones were more towards they were misinformed about getting vaccinated. They didn't have the knowledge of like getting Moderna is very beneficial because it prevents you from getting COVID as well as you can get sick, but you won't get sick to the very extreme where it causes death. Um, because of that, I think if people were more knowledgeable, if they didn't believe what the misinformed information that the news gave us, I think we would have probably had a more increased amount of Native American people getting vaccinated on the Navajo reservation. As also too well is that Pfizer used the Navajo people as test subjects to give out COVID-19 vaccinations. And it was more towards the elderlies that got it. Some people also stated that they didn't have transportation to get there. They don't know if the vaccination is going to change, is going to mutate their DNA. So yeah, if people were just more informed about the benefits that the vaccination could help, it would have more people being vaccinated once the vaccines are created. So it would have decreased our number rates of getting COVID.
Okay. Okay. And do you feel that there is also cultural factors that cause concerns to getting the vaccine?
Yes. So I don't know my tradition fully that well, but some people were saying that you were so even if you're Native American, you're supposed to have it naturally come through you, run through your body, like how you get sick. Some people get flu shots, some don't. Some just naturally get sick. Some people were saying that it's not part of our culture to get vaccinated from a white man's medicine, and that everything is more towards herbs. But
Hmm.
with me, my family, we both use Western medicine as well as traditional medicine hand in hand
Yeah.
to work better. So we also used our Western medicine as well as we drank our herbs in order to fully support us through this as well as prevent us from ever getting COVID-19. Even so, I think because of that, it helped us, it helped me and my sisters like try to inform other people that it's very beneficial for you to get vaccinated, and that even though you're vaccinated, you can probably still get it, but at the same time, use that traditional herbs that you have, put it together so you don't ever get COVID. So because my teachings, me, my sisters, my family, no matter how much we traveled outside, we never got COVID. We
That's good.
always we had that Western medicine, which was the Moderna shot, as well as the herbs that we drank every day. Every time we left the house and came back, we always had that herbs to drink. So yes,
Yeah,
there's
definitely.
cultural differences.
Definitely. No, that's very interesting to hear, and it completely makes sense of, culturally knowing that that is something part of the medicine that they use compared to the Western medicine, and that clash is something, that should be thought of, especially with doctors, and that's something that they should consider. So, do you feel that these concerns are huge among the youth? And if so, what are your thoughts on how to kind of, what are ways we can encourage the youth to get vaccinated?
Right now, right now with the youth, they don't care too much with their Native American traditions.
Hmm.
So in order for them to like tell them that you need to get vaccinated is um tell them that yeah, the news gives us information, but they only give us so little. So it's best that if you go to a medical professional that is able to explain to you how the vaccination works and that what benefits it can give you would be very helpful, as well as do outside research that involves more towards people creating research projects as well as systematic reviews, etc. Do research more towards health and not research towards people's opinion or like news media. So I think that if they did more research would be very beneficial, as well as use like media to promote that, oh, this is what the news isn't telling you. uh, they're leaving out certain parts about the vaccine that could be beneficial to us later on. It The vaccine never causes mutations, as it's only supposed to help us prevent us from getting COVID. Even though if we do get COVID, it's only to a limited extent, but it's not extreme as it should be if you got it naturally.
Okay. Okay. So I just want to confirm. So you feel that the youth are more open because they're kind of straying away from that conservative traditional thinking, and but the biggest thing is they're listening. Not only are they listening to the news or others' opinions, which is kind of misguiding them, but also their limited access to knowledge also is misguiding them, is what really is causing the concerns. And if there was better guidance and more medical professionals or people with that credibility would inform them, then they would be more open to getting the COVID vaccine.
Yes, having more guidance, but I would think that the guidance from a Native American to another Native American would be more beneficial,
Of course,
as
that makes sense.
we tend to like have that understanding of one another. So
Yes,
yes.
yes, definitely. No, that's a good point. Okay, well, thank you so much, Karen, for your perspective on how COVID-19 affected you and the community you grew up in. It was really interesting to hear about COVID-19, how it made a huge impact on your community, on the limited access and knowledge to healthcare, limited knowledge about COVID-19, along with the greater cultural competency that the Navajo Nation wished was in the healthcare system, and how the government could have played a bigger role in the educational system, along with the concerns that were brought up regarding COVID-19 and the vaccine. I really hope that things do get better, and uh, that things go more your way. And thank you so much, and hope you have a great rest of your day.
Right? Thank you, Sohail.
Of course. Thank you all for tuning in to the You in Youth. Stay tuned for the next episode as we continue to delve deeper into the different effects the pandemic has had on the youth and the communities. As always, I would love to have more people to join me on my podcast and share their perspective and story regarding their experiences of COVID-19. If you're interested in being a part of this podcast, please email me at sdaulat@email.arizona.edu. sdaulat@email.arizona.edu.